A lot of the political turmoil, a lot of the policy changes are really directly impacting communities and children in those communities. So, for instance, one of the communities that I work with a lot is a community of many immigrants from Central America. There is a lot of fear in that community. Parents are really struggling because they don't feel safe going outside of their homes. So that means it's hard for them to figure out how to get their kids to and from school. It's hard for them to get groceries. So there's a lot of fear, and that is certainly felt by kids. The impacts of trauma that they're experiencing at a young age are going to show up in different ways. It might show up in the way that they are having difficulties at school or difficulties finding employment. It might show up in their relationships. There is likely to be an increase in that mental health crisis and in those mental health needs. And that's really concerning, right? That we are making things worse for people and we're harming them. Anybody who's working with kids, one of the first things to think about is you can't do any processing or any other work really until there's some sense of stability and a degree of safety. Anybody can help support families and children in feeling safer. So you don't have to have a counseling degree. That's also important, right? If you want to do some of this other work. But I always encourage when I'm working with educators, when I'm working with parents, start with how you can help increase that safety and stability, whether that's figuring out the resources that they need, whether that's supporting them in terms of just being like a listening ear. So that first step is really key because you can't get into more of the in-depth trauma work as a counselor until the person that you're working with has some degree of safety and some degree of stability so that I'm able to have the capacity and enough emotional regulation to be able to start processing some of those things. So that's where I always encourage people to start, and everybody can have a role in that. If that is something that excites you, if you want to be part of helping folks heal, helping support communities, that is really what we are about in terms of training future counselors to address these social injustice issues through the lens of mental health.